Hi, and welcome to the Future of Dermatology podcast. I'm your host, Dr. Faranak Kamangar, board certified dermatologist. We are here to talk about anything and everything dermatology related. You'll hear from me and my guests who are dermatologists, physicians, experts, scientists, residents, and medical students in the field of dermatology. We publish weekly, so if you like what you hear, hit that subscribe button and show us some love, and thank you for joining us.
Hi, I'm so excited to be back. I've been very excited for today's episode. We have the lovely Dr. Forum Patel here. She needs no introduction, but she's a board certified dermatologist and she's fellowship trained in cosmetic and laser dermatology. She's at Aria Derm in San Francisco, and she is a cosmetic dermatologist extraordinaire. So I was so excited to have her here today to learn about all the things we can do specifically to fixing Ozempic face, but also all the other things she does in clinic. So
Yeah,
thanks for being here, Dr. Patel.
absolutely. Thank you for having me, Dr. Kamangar. I'm very excited. Dr. Kamangar and I go back like to residency
Yeah,
days, so this is just going to be like us chit-chatting away.
exactly. We go way back. So we were residents together at UC Davis, which I'm actually really happy we did a residency there because I do think we had a really diverse kind of a look at procedures too. So I feel like all the
For
residents that came out
sure.
of UC Davis were super procedural. You, of course, went on to do another whole year fellowship in lasers and cosmetics too. So I'm always like
Yeah.
when I have a question, you're the person I call, or and I'm like, can you
Oh.
demo this to me? How do you do this? So it's so fantastic and all the things you do. And in clinic now, you do mostly everything, right? Injectables, fillers. Like, what does your everyday look like now?
Yeah, so we do a good balance of medical dermatology. So, the bread and butter, like skin cancer screenings, acne, rosacea, rashes. But what I really find enjoyable are the procedural things. So, all the injectables with fillers, Botox. But I think lasers is kind of where my heart is at. So, I think with laser technology, things are just getting more and more advanced. If you look back 15, 20 years ago, we couldn't even do lasers on skin of color. So, the whole realm of cosmetic dermatology has changed completely, and I think it's going to continue to change. So it's very exciting to see where that's going to go.
Yeah, absolutely. Actually, I love seeing your posts whenever you post on doing Fraxel on like our type of skin type or even darker. And I'm always like, oh my
Yeah.
gosh, Forum's going for it. Dr. Patel's doing Fraxel. Because that's one of the things people are like, you don't do Fraxel on like our skin types, right? But you do it like so
Yeah,
well. And it's so amazing to actually see someone with that expertise. One, not being afraid of it, but just two, just knowing how to manage it. Or like if there's specific
totally.
complications or things like you just know what to do with that skin type.
Yeah, I think that's where like the training and fellowship really came in. If I had gone straight out of residency and, was told to do a lot of skin of color, I don't think I would have felt as comfortable. Obviously, me being skin of color, anything that I do on my patients, I've tried it first. So I think that's where the comfort level comes from. But it's exciting to see where that's going to go in the future.
Yeah, absolutely. And then mostly we went to talk about da 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 the Ozempic phase.
Da, da, da,
So
yes.
yeah, so it's definitely a hot trending topic, and we've been talked to on this podcast to some of our obesity medicine physicians about it as well. And the thought is, well, it's just really rapid weight loss, and when you lose weight, you lose volume in the face and fat, and so you just basically you can get that like I just lost a lot of weight look, but there does seem to be
Yes.
something more to it, right? Like that's kind of what I wanted to get your thoughts on. It does seem
Yeah.
to be like does have a specific look. Like it looks very specific. So I'd love to kind of get your thoughts
It
on it.
Yeah, absolutely. It's interesting. I think we call it Ozempic face, right? But there's like 4 or 5 FDA approved medications within that
Right.
class
Yeah. So
of,
it's
of
basically like a
drugs
GLP
that
agonist
essentially do the
face.
same thing. And the idea of losing weight and then seeing that weight loss in our face is not foreign. That's not novel. Even those who are going on hardcore dieting, we see this a lot, post pregnancy, when after pregnancy you're losing weight rapidly with breastfeeding. So people do naturally end up looking gaunt. I don't think that there's necessarily anything unique about these drugs in the quote unquote Ozempic phase. It's just that how quickly we're seeing that weight loss. And now that it's being marketed to, the public, there's more and more people that are on it. So we're just seeing a huge exponential like it's just more obvious that, we're
Yeah.
seeing people on a day to day with that, you know, quintessential gaunt appearance. But I don't think there's anything unique about the drugs that's creating that look. It's essentially just rapid weight loss. And we're seeing this more in those who are losing on average about more than 2 pounds a week. So if
Okay.
your weight loss is slower than that, we're not seeing as much of that kind of quintessential Ozempic face.
That's actually a really important point too. So maybe it's not specific to like the mechanism of it, but maybe specific in that it's just working really well. It's just making you lose weight better than other stuff has done
Exactly.
in the past.
Exactly. And something that I think the general public doesn't know much about is that like our face has a lot of fat in it. We have segmental fat pads all over our face. That's what, creates the aging face. That's what makes us
Mhm.
look, younger or older. And naturally, as we age, those fat pads get smaller. And now we're essentially, using a drug that's making us lose fat in other parts of our body, but it's not, our facial fat pads aren't immune to that.
Yeah. Yeah, absolutely. And I think it's true. We're losing fat everywhere when you're like on a GLP agonist, but that's probably where you're going to see it the most is the face because they're just these
Hmm.
like they make huge impacts when you do lose those fat pads. And we spent a lot of time at our derm
Exactly.
conferences learning about the different fat pads, how to replace it, what fillers to use, where. So I do feel like in this specific instance, our knowledge of obsessing about fat pads for so long comes in handy. So the
Comes into
dermatologists are like
play
comes
here.
into play here. We're like we are a good group of people to deal with this
Yeah,
like fat pad loss epidemic that's happening right now. We know how to fix it
exactly.
somewhat. So and yes, I'd just be curious at what how are you kind of dealing with it? Are you kind of on the more preventative side of saying maybe lose less weight less rapidly, maybe even maybe decrease the dose of the meds so that you're not you're just taking your
Yeah.
time with that weight loss, or just come and see me and let's start working on some regenerative things in the
Yeah,
office.
I tend to have pretty open conversations with my patients that, I see them frequently enough that if I do notice that, you're losing weight, I will approach that question like, how are you losing weight? Are you on one of these medications? Because it's a safe place to talk about. And if that, conversation is going, I feel like patients are pretty open to what their goals are when it comes to weight loss without the judgment of it. That being said, I do tell my patients, if you are on one of these medications and you are expecting or you're trying to lose a large amount of weight, you are going to notice changes in your face. And if that's something that you want to get ahead of, one of the things that I talk about is Sculptra. And Sculptra is something that I think was huge back in the early 2000s.
Yeah.
I think it's going to make a huge comeback with the Ozempic phase, um, because it's a kind of a natural way to reproduce volume without having that overfilled, quote unquote, pillow face that we typically associate
Yeah.
with hyaluronic acid fillers.
Yeah, absolutely. Sculpture is it's very different in how how it works. And I haven't actually used Sculpture in some time, but it's changed quite a bit, right? Haven't they made like the dilution a little bit easier, less likely to
Yeah,
get nodules? And I do feel like it's like a modern Sculpture now.
yeah. And I think, when Sculptra first came out back in the early 2000s, it was really marketed for HIV
Mhm.
lipodystrophy or fat loss in HIV patients. And I think what's so unique here is that, back in the 90s, early 2000s, us being residents, we knew what the HIV face looked like. You could,
Yeah.
pick it out of a
Mhm.
crowd. And there was a stigma that was associated with having HIV and having that, gaunt
Mhm.
facial appearance. And now here we are in, 2024, and we're seeing that same gaunt appearance, but in a completely different demographic. But there's still that social stigma associated with it. People don't want to make it known that they're on one of these medications just by somebody looking at their face. So when Sculptra first came out in like 2004, it was just being used for HIV lipoatrophy. Now, from a cosmetic perspective, it's being used off label for fat enhancement in all different types of the body, parts of the body, including the butt. So, and that's something
Yeah.
that we're seeing with Ozempic is that, not only are people losing fat in their face, but they're also losing fat in their butt where they might want to keep it. So I think there's
Totally.
gonna be a lot of
Hashtag Ozempic butt.
utility. Hashtag Ozempic, but
It's
you
trending.
heard it here first.
Yeah, absolutely. But you're totally right. I mean, I remember when we were even as residents, we were using Sculptra in our lipoatrophy patients. And I remember like we would do it at UC, but a lot of times it would be more at the VA, just the way that
At the VA,
residents were allowed
yeah.
to do more procedures in that setting. So we had our
Hmm.
vials of Sculptra, and you'd be like diluting it up beforehand. So it's ready to go. And it wasn't necessarily in that setting. You're right. It's like a different vibe. You weren't thinking of it in this like very just different population, like you mentioned, very different
Different
demographic.
population, yeah.
But really, ultimately, you're trying to fix the same exact thing of just that redistribution of fat throughout the body. For that
Exactly.
population, it was a little bit of weight loss, but also redistribution of fat. Like their fat was going into different
Hmm.
places, like the dorsal hump and the visceral fat pads and things like that. Whereas with the Ozempic, or I should just say GLP agonist, but we kind of call them as Ozempic, even though there's more than one. It's really just diffuse fat loss, right? So it's
Yeah.
basically just everywhere. So you're going to see it in the butt, the face. And those are probably the places people notice it the most. Because other places you
Yeah.
probably don't miss it as much. I'm trying to think. I'm like, are there other
Hmm.
parts of the body
Yeah.
you
The other
miss
places we
your
want to lose it,
fat?
maybe the chest.
Maybe
You
the
want to keep it
chest.
in the chest.
Yeah,
But,
right. Yeah, we're like, what's the next trending hashtag? Was that big body part?
yeah,
Because we
exactly.
have those Ozempic face, we have those Ozempic butt. But then the other thing is actually you can use Sculptra and other fillers for the buttock area as well. Do you do a lot of
Hmm.
that in your clinic? Do you do a lot of like the body?
Yeah. I personally do not. I did in training and in fellowship. We used to use Sculptra a lot for areas of like crepey skin, more related to age-related, just collagen loss in the décolletage and the inner arms. I have not done much butt Sculptra. I know a lot of providers do it. Currently where I practice, it's not something that's in demand. So in the SF population, we don't have people really coming in concerned so much about their
That's
butt
true.
butt
Yeah,
fat
we don't
loss,
practice
but
in
definitely a lot
Miami.
more
You're
for
right.
facial. Exactly. So, different areas, different demographics, but it is something that I think we're going to see more of, and it's going to be talked about a lot more. So, yeah.
That's super interesting too. And then aside from we talked about Sculptra quite a bit, what else are you kind of bringing in? Are you still doing some lasers and just getting some collagen rebuilding and kind of the
Yeah.
same, the different kind of things we do in clinic as well?
Well, I think the approach to the changes that we're seeing with Ozempic or the GLP-1 drugs is not just the rapid face loss, but as we're aging, just naturally aging, we are losing collagen, elastic tissue, regardless if you're on these drugs or not. So when we're approaching the aging phase, but now in combination with rapid fat loss, I think there's a two way of looking at it. There's skin tightening, and then there's also the volumization aspect of it. So, we talked about Sculptra and where it has a utility in just reestablishing volume, but I'm also using this in combination with a lot of skin tightening devices like radio frequency to enhance collagen and more so elastic tissue. Because if you just add volume to the face, but you don't have the framework to actually support that volume, you're still going to look unnatural. You're not necessarily going to have the most aesthetic appearance. So there is a two-way way of approaching this.
Yeah, absolutely. And then there's this concept too. I see a lot about people are kind of coining the collagen banking and do a lot more ahead of time. And I don't know exactly how I feel about that because you're going to build collagen at a certain rate. So I don't know if it's kind of
Hmm.
almost like get really bulky in high school, so then you never have to work out again in your future or something. That's kind of
Yeah.
how I see that collagen banking because
Yeah.
it's an ongoing process, right? Just like anything, like building muscle in your arms or anywhere in your body. Building
Hmm.
collagen is just this ongoing thing that happens in your body that you have to kind of cultivate and work on over time. But do you almost feel like there is an aspect of that where patients should maybe even start before they start these treatments, like to start kind of boosting some of that collagen and getting
Yeah.
in anticipation of
That
rapid weight loss?
abs absolutely. That's definitely a conversation I have with my patients. Again, like, if I know that they're going to be on these medications and they know that they're going to be losing weight pretty rapidly, I have that conversation of, maybe these are things that we do preemptively. And again, kind of bringing it back to Sculptra, that's one of the reasons why I love it so much, because it does look so natural,
Yeah.
and it's going to rebuild collagen at your own body's rate. So somebody who is younger in their 20s doing Sculptra, they're going to build up collagen much faster compared to someone who's in their 50s getting Sculptra. So getting
Yeah.
ahead of that collagen loss, I think plays a huge um, role in how we treat Ozempic face, just more preventatively, almost like in the way that we talk about Botox being preventative. If we're
Yeah.
starting to see those defects now, if we catch it early, it's a lot faster or a lot easier to reverse.
Totally. I'm all about the preventive Botox. I know there's a bit of like controversy or like, do 20-year-olds
Hmm.
need preventive Botox? I'm like, yeah, they absolutely do. And I think we kind of just naturally were the population who did that because like in our mid 20s, we
Hmm.
were all in residency practicing on each other, right? Like whether we were trying to like make these major societal decisions, we were just like, oh, cool product. I want to know how to
Yeah.
use it. Can I put it in your face? So we kind of did that to each other where, with like
Yeah.
different lasers and Botox. And now that I'm like my 40s, I'm like, I'm really glad we did. I'm really glad we started. And I
Yeah.
know there's no like major recommendations. Okay, if you're
Yeah.
28, you have to go and start
Yeah.
doing
Start
Botox or anything
now.
like that.
Yeah.
But it's like, it doesn't hurt, right? It doesn't hurt to start doing these things earlier.
Yeah, I mean, it's all based on, your approach to it. I'm not someone who will heavily enhance someone with, tons of Botox, tons of HA filler, but I do think
Yeah.
that there's a way of providing a very natural aesthetic. And my kind of rule of thumb is that, if there's a wrinkle on your face and that bothers you, it's going to bother you in 5 years or 10 years. And if there's things that we can do that can safely address it, let's talk about it. If that line doesn't bother you, it doesn't bother me.
Yeah.
So it's all very, very personal to what, each individual person's goals are.
Absolutely. You make a really good point about the individual treatment, which I think what dermatologists are really great at, because I feel like if a 28 or 32-year-old came into our office, we would use very minimal product or whatever we were doing based on what's
Hmm.
needed. Whereas I think what you're seeing now, there's like the different things that people post about, like why are millennials and Gen Z just looking different and why do they have so much stuff done to
Hmm.
them? I think it's because they're getting this like cookie cutter thing. Like if a 30-year-old is going in, they're getting whatever the 65-year-old is getting too, which is not like
Right.
that's not necessary, right? It's like it's so that individualization is
Exactly.
just
Yeah.
so important. I think that's the part people miss because I think they think, well, if you go in at 30, this is what you're going to look like, but not really if you just do tiny bits, right? Like what you said, like just the right amount of what you need to get the
Exactly.
job done, basically.
Exactly. It's the same concept of, if you're going to have a physical trainer that's going on like a journey with you, right? You're sticking with that trainer. They're going to know your body the best. They're going to know your goals the best. The problem, I think, with a lot of these cosmetic treatments is that it's so widely accessible that people can go to any sort of provider and easily say, I want 30 units of Botox, or I want, lip filler and tear trough filler, and they will receive it. There'll be a place that will provide that service. But I really like to, approach cosmetics in like, what are our goals? What is the patient's goals, and how can I help kind of take you into that journey? So I like to think of myself as, kind of analogous to that physical trainer where,
Yeah.
people aren't just going to come into my office and say, this is what I'm here for. There's going to be a discussion about, is this the right thing for you?
100%. I think that's really what we are. You're right. Like we are just because like, yeah, you're going to your physical trainer, you're fixing your nutrition, you're building muscle. If you want to build collagen and these different parts of the skin and body, then you do need to see us on a longitudinal basis. And we need to really, I think my patients who I feel look the best are the ones where I've had this longitudinal relationship with them. And there are some that I
Yeah.
did start seeing like in their early 30s, and we were doing like baby doses of Botox. And sometimes they'd come in and I'd be like, we don't
Hmm.
even need it today. Come back in another
Yeah.
3 months. And that's the kind of relationship you need with someone who's not thinking about it from a business standpoint, but what do you need right now,
Exactly.
sitting in front of me in the office. And then
Right.
they've gotten a little older. Maybe they've had some children. Now they're getting that facial atrophy and the volume loss that happens in the 40s. And you're totally right. It's that like longitudinal relationship and what's needed. So I think everybody really needs like a good derm trainer.
A good dermatologist.
A good
We're the derm
dermatologist
trainer,
trainer. We
exactly.
need like a, yeah, there needs to be a term for that, because it's collagen is very similar to just like how the other proteins in the body are, like muscle building. Like there's a very
Hmm.
specific, I don't think anybody would expect that they would like get a Groupon for something, go in once, get one procedure and feel like, oh, well, I'm going to have all this muscle gain. Like people don't
Yeah.
understand that like muscle gain is this process.
Yes.
So it's just
And
kind of
same thing
like
with
that
collagen.
understanding.
Exactly. Yeah, there's definitely a maintenance to this. Anything that we do to enhance someone's appearance in the present, there's going to be a maintenance approach to it going into the future. So even with Ozempic and fat loss, it's not about how many vials of Sculptra can you put into someone's butt and then, call it quits, because you're naturally still going to be aging. Your weight is still going to fluctuate. So, having that open dialogue with the patient, I think is really meaningful.
Yeah. And I kind of feel like it's like we're talking about the weight loss being this gradual thing. I think the best cosmetic outcomes are done gradually as well. And I think that's something
Absolutely.
hard sometimes to talk about. But I now tried it with some of my patients. I don't know if you take this approach, but I literally will be like, this will take a year or two. Let's start working on things. I'm not sure
Yeah.
how do you approach that in your consults? Do you give people
No,
like a
that's
sense of
exactly,
chronicity?
absolutely. My approach to a new patient consultation is really, what's on your priority list? What is bothering you? And then let's build up a timeline of what seems realistic. Because it's not going to benefit anyone to overpromise and underdeliver. And, for the person who thinks that this is going to be a quick fix, whether it's from Ozempic weight loss or, getting their lips filled, um, I think that they're just going to set themselves up for disappointment.
Yeah. Yeah, absolutely. No, it's such important points. So I'd be curious, actually, just going specifically into Sculptra, and hopefully, actually, at our upcoming conference at SF Derm, I'd love to actually see if we can get you to demo it and just see how you do it. And if we
Yeah.
do, we'll put up some videos of it. But what's your general like? How are you using it now? Are you mostly
Hmm.
using it in more like the cheekbone area, or are you doing like full face Sculptra? Like, what is your kind of usage of it now?
Yeah, so when we look at the aging face and, just the natural progression of the aging face, there's certain areas that we naturally lose fat in, again, even without these medications. So it's very common to start losing fat in our temporal areas, our lateral cheeks, our medial cheek fat pads. And one area that almost every woman kind of complains about are these quintessential smile lines, not caused by smiling too much, but just a shift in how our bone structure and our fat pads are sitting as we get older. And my approach to Sculptra has been, really addressing those vectors, the temples, the lateral cheek, medial cheek, and the smile lines. And I think this is where Sculptra really shines is, it's building a framework, a scaffolding for your own body to then rebuild collagen. So you're always going to have a natural appearance. I think some of my patients who come in with the complaint of they don't like their smile lines, or they see that their mom has really bad smile lines and they really don't want to get to that point, I approach the conversation of doing Sculptra early on. So, can we slow down the progression of it? Not necessarily, let's just put a whole bunch of HA filler there and over time it's going to look heavier and heavier.
Yeah. Yeah. And then do you do what's your, I'm sure it's very personalized, but do you generally start with like, okay, we're going to start doing this every 4 to 6 weeks for a certain amount of time?
Yeah. Definitely depends on, what they're coming in for. So if they're already naturally having a very lean appearance and they have what I call pan facial hollowing, we'll usually do about one vial of Sculptra every 4 to 6 weeks for a session of three. And then I see them back in about 3 to 6 months after, because it's going to take our bodies naturally about 3 to 6 months to make that collagen. That's why I say with Sculptra, it's a journey. It's not a quick
Mhm.
fix. You're not going to go home and be like, oh, I look totally different. But that's also where the beauty of Sculptra lies, that you're going to see this natural progression of volume enhancement. So it's not overnight, but it definitely looks a lot more natural. At that 3 to 6 month mark, we compare photos. We reassess. Are we meeting the goals that we wanted to meet? Are you happy with what you're seeing in the mirror? And if the answer to that is yes, then we do maintenance kind of once a year, because you want to keep that collagen remodeling going. So if you do a session of Sculptra, you're really happy with it, and then you never revisit it, 5 years down the line, all that collagen that you built up is now gone because your body will naturally metabolize that collagen, regardless if it was produced by the Sculptra or just, you know, normal collagen that our body has. So having that maintenance regimen and making sure that, the person does know that this is a long time journey, not a quick fix.
Yeah, and it sounds like you're doing it like at a very normal rate because you see people going in and getting like too much sculpture done. And so
Yeah.
you're doing it just beautifully. We're like, we're just gonna do little bits at a time.
Small
And
amounts, because I think small
small
amounts
amounts.
go a long
Yeah.
way,
Go along.
if
Yeah.
if
And
we
you're
let time do its
probably,
thing.
yeah, and you're probably not seeing a lot of like nodules and like, those kind of traditional kind of side effects that people worry
hmm
about.
Yeah, especially, I mean, Sculptra, again, when it came out in the early 2000s, that dilution method for Sculptra, it was more concentrated. So it was more
Yeah.
common to see like nodules or granulomas form. We're not typically seeing that with the new dilution. It also allows us to stretch out a vial of Sculptra. So we're not having to add as much product. And I think getting a much more beautiful, natural result.
Yeah. I can't wait to see how you inject it. We'll have to get a demo one way or the other. We'll get a video of this,
Yes.
of your beautiful, beautiful sculpture application. And anything else about Ozempic face before I ask you about what you're super excited about for the future of dermatology?
Well, with Ozempic, I think I'm really interested to see where body changes with Ozempic goes and how we're going to use a lot of these cosmetic treatments to treat other parts of the body. Kind of going back to like the Ozempic butt, I think we're going to see a
Yeah.
lot more filler butt enhancements, maybe not in San Francisco, but definitely in other
Yeah.
parts of the country. But I think that's also where, again, Sculptra is so unique, is that I think it can give a really naturally enhanced backside, whereas we typically
Yeah.
think of, BBLs looking very, very obvious. So I think there is going to be some utility there.
Yeah, absolutely. I think you're right. The face is just like the beginning of it, right? We're learning so much about these medications. And even on the medical dermatology side, we're learning so much about like what the GLP agonists are going to do for the inflammatory skin disease and psoriasis and eczema and that whole like weight loss connection there. So I think it's just the beginning of it. We're going to be learning so much more. So we'll just have to have you come back, talk
Yes.
more about it. And we've kind of, I
Yeah, I don't
think,
think
already
these meds
touched.
are going anywhere.
They're not going anywhere, right? Just the beginning of
They're
it.
not.
And we were talking
Yeah.
to an obesity medicine physician too, who was saying that. So right now we have the GLP agonist, and then we have the dual one with like Monjaro that has like the GIP and the GLP, and they're coming
hmm
out with like new ones that are targeting three receptors. So I feel like they're going to get even better and better, but then maybe more
Yeah.
rapid weight loss. So we'll be seeing more of the patients coming in with more volume loss.
Yeah.
And
One of the things
yeah,
that, oh, sorry.
no, go ahead.
I, I, I was just going to say one of the things I forgot to touch on was that, when we are talking about rapid weight loss and nutrition, having that well balanced diet, even if you're on one of these medications and the goal is to lose fat, you still want to make sure you're getting enough protein, healthy fats, because if you are going to approach something like Sculptra, it's relying on your body's ability to make new collagen. You need those building blocks to make collagen. So if you're someone who's on these meds but also having a very poor diet, it doesn't matter how many of these procedures we do, your body is not going to be as responsive to it. So I think that's a really important point. If you're on these medications, you still want to focus on having that well balanced diet if you're looking into doing some of these facial enhancements.
Oh, totally. Actually, we should even just have an episode talking just on that. That's probably 90% of it, right? It's so taking it back to like
hmm
the gym analogy. So if you're exercising and you're doing all these weights, but you have zero protein intake, you're not going to build muscle. I think that's a concept
Exactly.
everybody knows,
Yeah.
but I don't know if they necessarily associate like collagen synthesis with that nutritional kind of intake as well. Just speaking of, do you have your patients take collagen supplements around the time when you're doing? I mean, I know we don't have, I
Yeah.
don't think we have
I
all those
do
data
not.
trials showing, one versus the other, but
No. The data is so mixed as to, does dietary collagen actually do anything
yeah,
for skin, hair, nail health? When we think about our bodies, like every single organ in our body requires collagen.
Hmm.
So what's to say that if I eat this collagen powder, this collagen is now going to my skin versus my
Yeah.
eyes or my heart? So there's no way to really track for that. I tell my patients, if it's something that you enjoy taking, it's not going to hurt. But I wouldn't rely on dietary collagen as being this kind of magical pill, because if it was, we'd all be on it right
We
now.
would know. Yeah, yeah, we would definitely have an answer
Yeah,
to it if it was like this. Like, and they're not inexpensive either. It is like
yeah.
another thing that a person has to do. So if it's going to be like $600 or $700 a year for the collagen supplements, maybe instead of that, you
Hmm.
substitute that with, like, if you're choosing, if you want to do it all, great. But if you're choosing, maybe you're better off doing a couple of microneedling sessions, or maybe a vial of Sculptra,
Right.
or something in its place. But I
Exactly.
would, it would be interesting if somebody could do those studies. You would just kind of wonder, because really, like what you mentioned, is you're taking in either protein supplements or collagen supplements. You don't really know if they're necessarily going to get traced back to the skin. Some of them are bioactive, so maybe they're triggering a little bit of
Hmm.
collagen synthesis in themselves. But really, ultimately, what you're doing is you're just putting more amino acids around in the body, which could be done with food too. But in theory, we're not all
Yeah.
eating all the right stuff and like sitting there eating bone broth
Right.
all day. And then maybe the patients on GLP agonists are even taking in less food. So maybe there's like less just stuff
Exactly.
around. So I would be curious at some point if anybody does this study, which it would probably be really hard to do as well, is
Yeah.
if you kind of boost or collagen boosting procedures with some sort of like high dietary intake of collagen, just so you have the amino acids around, do you get
Yeah.
more of like collagen building, or does it make any
Yeah.
difference? I don't know if we know the answer to that, but
Yeah.
it would be an interesting one.
And it's also really hard to standardize dietary collagen, right? That not each brand of collagen powder is completely
Yeah.
different. So how do we even, unify that as to, what's the good stuff and what's the bad stuff? So there's so many variabilities, and
Yeah.
because of that, it's not something that I typically will recommend my patients to be on. But again, if it's something that's already part of their lifestyle, by no means is it necessary to
Right. Yeah.
change.
Definitely doesn't hurt to do it. So for sure. No, and a
Yeah.
lot of our patients ask that. Usually it's a question when you're leaving the door, right? Like your visit is done and you're leaving and you're like, oh doc, what do you think? Should I start also taking
Yep.
some collagen? And I think just both of us also being so kind of like we just don't have enough data on it speaks to it, is that we just don't have
Mhm.
like a, yeah, totally do this or no. But it's pretty harmless. So
Yeah.
if you're doing it, feel free to keep going with it. Perfect. And
Yeah.
that, I mean, we've kind of been talking about the future already, but our last question, anything you're extra super excited about for the future of dermatology? Any trends you
Yeah.
see ahead?
I think that the way we practice dermatology is going to be vastly different in like the next 10, 15 years because of all the AI technology that's coming out. I know this is kind of a field that you're really interested in, Dr.
Yeah.
Kamangar. And so I'm really excited to see how that's going to help us streamline our consultations, how we provide information to patients, um, kind of having more access to all the products that are out there and being able to give more customized recommendations, because right now there's this infinite amount of data and no one person can really absorb that data and give the right recs to each patient. So I'm really excited to see how AI is going to change not just dermatology, but I think the field of medicine.
Yeah, no, I love that. Me too. I agree. I think hopefully it's going to kind of fill a lot of the gaps of kind of the bad technology that we've had adopted
Hmm.
over the last like 10, 15 years, that's making everybody go crazy. Hopefully fills in some of those gaps and makes that technology better. But then like the thoughts about all the access pieces and all everything we can, the knowledge curation we can have for patients,
Yeah,
is kind of
more
incredible to
data
think
I think is
about.
just going to help.
Yeah.
Yeah.
Exactly. Yeah, like a lot of the different centers are even getting like all the data from the EHRs and being able to do research on it, and yeah, it's
Mm.
kind of incredible to think what it's going to look like in like 5 to 10 years from now.
Yeah, hopefully we're
Absolutely.
still practicing by that point.
Yes, exactly. Hopefully we're still here for it. And then hopefully we're not
We're
kind
still
of like,
here.
hopefully we can keep up with it. Cause I think if you remember like when the electronic health records came out, we were like not phased by it at
Yeah.
all. Cause we were like in our med school or residency phases. There were a few of the older
Yeah.
docs who were like, I'm retiring now. I'm not ready for this. And they like left the
I know.
field.
Hopefully that's not going to be us.
Hopefully
So we
that's
gotta
not
we,
us. And
we
we can
gotta
keep
stay on
rolling with
track.
the punches.
Yeah. We
Oh,
can't show our
thank you.
age just quite yet.
Yeah. And with
No.
Sculptra, we're going to be looking 30. We're going to do it like J-Lo, where she's
Yeah.
been 30
If we
for
do it
25
right,
years. Yes,
that's the
we're going to
olive
be 30
oil.
for the next 25, 30. It's the olive oil. You're right. It's not the Sculptra. It's the
Oil.
olive oil that's keeping her young. Perfect. Well, thank you so much. Thank you for joining
Absolutely.
us.
Thank you for
And
having
I learned
me.
so much.
Thank you for listening to the Future of Dermatology podcast. Remember to hit that subscribe button and share the podcast with your friends. The more you share and subscribe, the more we'll be able to grow and share our dermatology knowledge. If you have burning dermatology questions, feel free to leave them in the comment below, and we would love to address them in a future episode. And please note that this podcast is not intended to substitute for medical advice from your doctor.